Hello everyone. I sincerely thank you for this opportunity. I'm Curie, Professor Emeritus of Nephrology at Seoul National University. Today I will share Vitallink in Asian eremiosis, drawing from the Mongolian experience. 28 years ago, I founded and led the Rafael Clinic in Seoul, providing free healthcare to nearly 400,000 immigrant workers from over 100 countries. In 2021, we expanded our care to homeless patients. Rafael has since grown into 3 branches: Rafael Clinic for migrant workers and multicultural families, Rafael International for global outreach, and Rapaelna눔, the headquarters. Through Rafael International, we could offer a variety of programs tailored to the specific needs of each country. Rafael International's work began in Mongolia in 2007 at an outpatient clinic in Yarmak-Hangol near Ulaanbaatar, launching a chronic disease prevention project. Over time, we saw challenges in Mongolia's medical education system after Russian support ended. To help, we started a fellowship program training young Mongolian professors at Seoul National University Hospital. Nephrology trainees, upon their return, advanced the dialysis program, performed kidney biopsies, and launched the Mongolian Nephrology Society. In 2011, Professor Nyamshu Ren, director of the Transplant Center at First Central Hospital of Mongolia, visited one of our seminars and shared his desire to develop organ transplantation system in Mongolia. Initially, I was skeptical given Mongolia's limited hospital and human resources at the time. However, I believed Mongolia was in a better position than Korea had been post-war. So we decided to develop a transplantation capacity building program following Rafael International's framework, starting with assessment and culminating in sustainability planning. The first step assessment includes a literature review and site visit focusing on Korean site capacity. We secured the commitment of Professor Min from Seoul National University Hospital and support from Vitallink and Rafael International. Vitallink, founded by Korean Society of Transplantation, educates Koreans on disease organ donation and transplantation. To combat organ trafficking in Asia, the Vitallink launched its overseas program in 2011, starting with the first Vitallink International workshop in Seoul. In 2014, it co-hosted a workshop with TTS and WHO on achieving self-sufficiency in organ transplantation in Asia. Rafael International, part of Rapaelna눔, already had a secretariat office in Ulaanbaatar supporting the launch of Mongolian transplantation program. At the time, Mongolia faced high burden of chronic kidney and liver diseases. While organ transplant team exists, medical capacity remained limited. The first organ transplantation law was enacted in 2000. With the president of First Central Hospital of Mongolia, FCHM, declaring that transplants could only be performed at FCHM and committing to expanding its transplantation facilities. Immunology lab provided cross-matching and HLA testing, though with insufficient quality control, and the levels of immunosuppressants could not be measured. Kidney biopsies were performed by nephrologists trained through the Vitallink Fellowship, but with only one pathologist available, transplant pathology remained unassessed. The annual number of transplant was 10 to 15, mostly conducted by visiting foreign doctors. By 2011, more Mongolian patients sought transplant in China, leaving local doctors still underprepared, struggling to manage the complex care of returning patients. What impressed me most was the passion and eagerness of the Mongolian doctors. Despite the challenges they faced, their dedication to ensuring the success was truly remarkable. The second step was forming a core team from both Mongolian and Korean sides to collaborate until the project's success. The initial Mongolian members included Professor Nyamshuren, Professor Adna, and Professor Byamdoruch, a nephrologist who later became Deputy Minister of Health. Maintaining mutual trust is key, and we've had invaluable support from advisors like Professor Emeritus Gelangjamjik and Professor Jeremy Chapman. This foundation has helped us building a strong Mongolian transplantation team. The third step, project planning, included consensus workshop, risk mitigation, and financial planning. Typically, 2 to 3 workshops were held to finalize these plans, as seen in this photo from Myanmar. In Mongolia, these workshops posed challenges much like in the situation in this picture. Despite this, we could set up our first goal, enabling FCHM to independently perform living kidney transplant. To achieve this, we implemented 5 key programs: fellowship training, on-site workshop, hospital infrastructure development, a national deceased donor organ transplant program, and re-education and updating. The fellowship program brought Mongolian medical professionals to Seoul National University Hospital for 1 to 3 months of training. At times, trainees were older than their supervising professors, occasionally causing a mistaken role reversal. So far, around 90 professors have completed the program and returned to Mongolia. The on-site program includes 3 annual sessions. First, a surgical workshop where the Mongolian-Korean team advances kidney transplantation technique. Second, a seminar on clinical transplantation and transplantation consultation. 3, the Vitallink workshop dedicated to developing a disease organ transplantation program. TTS co-participated in all seminars from 2014 to 2012. The Vitallink workshop extends beyond the seminars, including visits to MOH and WHO, policy discussions with the governmental leaders, and the Donate Life campaign, such as the Donate Life concert at Sukhabatar Square. The 5th step focuses on monitoring and evaluation to assess progress and refine the project direction. This includes an annual visit to Mongolia and the Vitallink workshop held during Asian Transplantation Week in Seoul and CAST. Findings from GODT and ASTRAC are also used for tracking progress. Step 6 involves establishing a sustainability plan. Once a National Transplantation Society, official national authority, and OPO are in place, we start to implement our exit strategy. In less than a decade, the Mongolian team has made remarkable progress. The Mongolian Society of Transplantation was founded in 2017, with activities expanding each year. In 2019, RDC TOT, the National Authority and OPO, was established to manage a transplant disease organ transplantation program. In 2024, the NGO Forever Beating Heart was launched to raise public awareness. Now, many Mongolian doctors attend conferences worldwide, further strengthening the country's organ transplantation capacity. Building on its success in Mongolia, the Vitallink organ transplantation capacity building project is expanding to Asia. Growing interest has led more medical professionals across Asia to seek support. To structure this, Vitallink Academy was established in 2023. In spring 2024, the Level 2 program was successfully launched like this, with many TTS and Asian members participating as advisors. In 2024, the TTS Vitallink workshop was held during the TTS 2024 at Istanbul, and the TTS Vitallink seminar is scheduled at 2025 WTC at San Francisco. Organ transplantation improves survival and is life-saving and more cost-effective than hemodialysis, but requires multidisciplinary expertise, challenging for low-middle-income countries. We look forward to working with you, as this journey has shown that together we can achieve our goals and go even further. Thank you very much for listening. Thank you.